gentlemen. The topic of our research is a musculoskeletal syndrome and spine correction by means of a Cordus device. Cordus is an innovative device aimed at using autogravitational therapy for treatment and correction of spine. This technology is being actively used while tackling such spine diseases as osteochondrosis of any type, scoliosis, mainly of the first and second types, pinching of the sciatic nerve, and first and foremost, once, for instance, the person might be having different protrusions and spine problems caused by a hypertonus of spine-related muscles. What is the main reason of spine disorders? We have divided them into several key factors. The first factor is an excessive overload of muscles of the spine. Second is in micro-traumas of the spine due to different overloads. And the third number is the possible overcooling of the muscles. And the fourth one, it's an emotional state of a person when we just standing, sitting, or doing some physical work. This is the so-called late overload. What is the main reason of the spine problems? Most common one of the problems that I've noticed is the spasm of spine-related muscles, which leads to an excessive tension in muscles and leads to a blockade of the spine system. An interesting fact is the majority of people, or even everyone at the age of 26, already has some protrusions. However, many of us haven't noticed that. The therapy task is to effectively and softly and comfortably work with a human spine, and at the same time to effectively reduce any signs of spasms, and thus to facilitate an extra tension of muscles and to mobilize spine segments and to restore the primary spine function. What is the essence of autogravitational therapy? Autogravitational therapy is a method of deep relaxation of spine-related muscles by means of a device. Predominantly, we're talking about a body weight that is being applied to a device that in result affects deep muscles, which leads to the subsequent relaxation. These perivertebral muscles, they're normally called as the tonic ones. They're called this way due to the fact that you may have troubles relaxing them. The only common way when you can relax them is once you're just sleeping. However, if we're going to apply some kind of a device, in this case we're talking about a Cordus device. If we're applying Cordus device on these muscles, then the spasm muscles will relax within a couple of minutes and this tissue will stretch. There are many factors that provoke such an overload. Once we're sitting too much, once we're doing some heavy work, once we train, run, all this provoke tension of these muscles. Once they get extra overload, then it's extremely difficult to relax them. As a result, the main focus of autogravitational therapy is aimed at a mechanical impact on these muscles that, by means of proprioceptors, allows relaxing this tissue. What's the mechanism of autogravitational therapy? Well, many researchers that have been studying this topic for more than 20 years have identified a number of key mechanisms. One of the mechanisms is that once affecting the trigger zones of these muscles, active impulses coming from proprioceptors relax the muscles.
Второй механизм заключается в том, что воздействуя на суставы, на область как раз дугоотрочатых и фасетов.
And the second mechanism is when the knuckles get into a state of a so-called opening, where each segment of the body begins normal functioning. Third mechanism is when we affect our muscles, then one segment of the spine compared to another segment of the spine might be getting more space. As a result, if we've had some protrusions, then the whole segment starts recovering. We eliminate this compression, and this leads to reduction of this particular protrusion or any other spine-related problem. Thus, autogravitational therapy is being actively used as a complex method of spine treatment in case of any spine disorders, and is aimed at the accelerated recovery of the spine, reducing any pain as well as compression.
Как обычно, можно...
How is it possible to relax these muscles?
Эти мышцы.
Nowadays, there are different means of relaxing these muscles. For instance, you have tennis balls, or you can have some stretch techniques that allows relaxing these muscles. However, you have to note that for an effective treatment, you have to follow a number of principles. The first principle is to locally affect a specific segment of the spine. The second one is that the device needs to penetrate the muscle depth of 3 centimeters. The last one, after having relaxed the muscles, you need to immobilize them so that any part of the spine would take its normal position. Hence, these are the 3 key principles that you need to follow for an effective elimination of perivertebral hypertonus. As we can see here, we have a number of examples, and each of them has a number of disadvantages. These particular things have a local effect, and then their use is quite limited, meaning that their effect is aimed not on the entire spine, but only its segments. For instance, they stretch certain muscles, and others are not being affected fully. In this case, we have developed a Cordus device that perfectly fits these 4 criteria. First and foremost, this is the local impact of the following segments: neck muscles, chest muscles, and small of the back. Regarding the depth, as you can see, we're talking about 3 centimeters. That allows us to deeply penetrate these muscles. active impulses coming from proprioceptors allows better relaxation of these muscles and to stretch muscle tissue, thus to reduce the hypertonus and to mobilize certain spine segments. More than 65% of people do not feel degeneration of muscles and the development of hernia. And the sooner we start the treatment, the better it would be eventually, and as a result, a far less amount of negative consequences a person would get. If a patient is older than 20 years old, then it would be a good idea to do the diagnostics of the entire body and see what's the current condition of that person's spine. What is the clinical data that we have gathered during our trials? During the medical trials with more than 60 patients, we have identified that with such spine disorders as hernia, osteochondrosis of any type, different types of neurology, pinching of the sciatic nerve, during just one course of treatment that lasts normally for about 1 month, we have got good results related to the reduction of these particular symptoms, namely reduction of hernia size, elimination of spine pain, improvement of spine mobility, improvement of flexibility, and even improvement of emotional state. Because we're talking about muscle pain that obviously affects the emotional state of people. As a result, after having eliminated this pain, a person begins feeling much better, and that person begins experiencing better quality of life. What is the essence of the innovative technology of a cordless device? The innovative technology is that it affects all the spine segments. We're talking about the neck segments, we're talking about chest segments, and last but not least, the small of the back. Impacts of the device on the deep muscles is around 2 to 3 centimeters, which is optimal for spine treatment. At the same time, will locally affect certain muscles, thus letting other spine segments to mobilize and get back in normal position. Thus, we conform with 4 key principles of manual therapy. As you can see here, we have outlined 4 key principles. In the beginning, we stretch the muscle tissue. Later on, we relax them. The third stage is when we are mobilizing spine segments, meaning that if we have a damaged spine segment, then its muscles will bring it back to its normal position. And the last principle is the stabilization. Once we have done all the techniques, we would need to mobilize the tonus in the muscles and to center the symmetry of spine segments. Here we can see how the device works, namely its 3 sides. I already mentioned how it all works. However, I will say that it is necessary to locally affect each spine segment. As a result, each side represents a perfect solution for each spine segment, where we're talking about neck, where we're talking about chest, where we're talking about the small of the back. If we're going to take a look at other devices, then we would notice the following. They're either too big, they're too expensive, they're ineffective, and last but not least, they do not allow penetrating deep muscles.
Проникновение в мышцы и локально на нужный сегмент позвоночника не действует.
Thank you very much. If any questions, I'll be pleased to answer them.
Yury, why is it necessary to unload deep paravertebral muscles by Cordus device for 3 minutes? Thank you.
Yes, this question. Почему 3 минуты
That's a very interesting question.
на вот эти вот мышцы обусловлено тем, что когда происходит воздействие аппарата на эти мышцы,
The reason behind the 3-minute relaxation of each spine segment is due to the fact that our brain works in the following way. After 2 and 2.5 minutes of relaxation, the brain stops receiving signals from these particular muscles, which leads to their particular relaxation. And this is the reason why we actually do recommend relaxing each spine segment for 3 minutes.